Hi, everybody. Welcome in. Today's webinar is Beyond Buying Power, how Atrium24's GPO helps you compete, save, and grow. I know Nicolette and I are both on this slide here. Unfortunately, she is not able to attend today, so you are stuck with me. But my name is Annie. I am a pharmacist and the clinical director here at Atrium. And today we are really just going to review Atrium24's GPO, what it is, how to get started, and why we really saw a need for it in this market. Of course, you're all familiar with the challenges that we're seeing, the decreased reimbursements that we're getting, all of the issues that come along with insurance, but there are a lot of opportunities as well. So those opportunities really that we're seeing for a lot of pharmacies and a lot of growth is through compounding, cash-based models, and the wellness and telemedicine space. So what's really great is even if you are not a compounding pharmacy, you can now purchase and sell compounded products, especially the ones that are most popular with your patients. We will go a little bit deeper into that later as we go on, but it's really important to think as the landscape has changed with pharmacy and reimbursements, what are you doing to keep up with what's happening? As you see, all of your patients are turning to telemedicine. They're turning to the newer kind of therapies. Their thought processes are moving more from reactive to proactive. How do I stay healthy? How do I make myself the best that I can be? So really, where we're seeing the most growth is in these spaces, and we're here really to help you capitalize on that. So what makes our GPO different? We went over it a little bit different, but it does reduce the cost across multiple innovative product categories. So we're going to go through all of the components that are in our GPO right now, but we really saw a need for this. So of course there's GPOs. I'm sure you all have a buying agreement for your regular medications, but this is one that's going to help you save on all of those new ones that your patients are going to be looking for, the ones that are going to be those cash-based models that you're really going to be able to make a profit off of and help support your patients where they can stay with you in your pharmacy, where you know what medications they're on, and also getting things from a pharmacy that they can trust. So our GPO obviously was designed for independent pharmacies, and we also offer onboarding support and a lot of partnership benefits. So as we'll talk especially through some of the 503Bs that we have, this is fairly new even to them. So we've really helped streamline the process for you, and we're able to aggregate the purchasing power among all of our Atrium pharmacies. So whereas if you tried to go out and negotiate for yourself, you might not be able to get as good pricing since most of them go off of a volume-based discount, but we're able to combine all of that purchasing power from all of our pharmacies. We also offer that ongoing support where we can help communicate between the two. We stay up to date on what's coming out, what's coming next, and we try to include all of the therapies that we think our pharmacies are going to be interested in. We are always continuing to update our partnerships and bring in new therapies that we know are going to benefit the pharmacy. So some of you on here might not even be familiar with really purchasing from a 503B if you haven't been doing it already. So 503B outsourcing facilities are more like manufacturers. So they follow CGMP when they are compounding their products. There's additional testing that goes along with it. And really, through 503Bs, you are afforded a really quality product with that testing behind it, which is wonderful. So in 2023, the FDA came out for a guidance for industry that really clarified that 503Bs, who traditionally mostly sold to hospitals and to clinics, could sell to pharmacies as well. So this was actually never disallowed, but this guidance came out kind of letting them know, yes, the process is that you can sell to a pharmacy, like a 503A pharmacy, which is what all the independent pharmacies would be here, whether you are a compounder or not. And you would purchase like you would through your manufacturers. So you would get a finished product. So we'll just say NAD, you would get a vial of NAD. It has an NDC number on it. And then you can just keep it in stock, or you can be ready to sell it right away. You would take it from your shelf or the fridge in this instance, and sell it to your patients pursuant to a prescription. So we have listed on here some of our 503B partners. We do have more, and more will be coming soon as well. But I'll do a quick overview. PQ Pharmacy has some of the GLPs. They have sterile eye drops. They are also moving into the wellness space. So they are going to be offering, they have glutathione right now, but they're going to be throwing in all of the usual products that you're going to see, like the Sermorelin, the NAD, the B12, the MEC. Um, and then Olympia has a very extensive product list. So mostly sterile injectables, all of the wellness injections. That's going to include a lot of vitamin injections, IV bags, a ton of different options there. They also have a lot of ED injections. So if you're looking to move into the urology space, it's a great option. Wedgewood is a veterinary 503B. So that's another great one to offer. You can either start out with your veterinary compounding, or let's say you already compound, but you don't do sterile, or you're looking to bring in a couple more things that you don't want to make in-house. They have a really great catalog as well. Eagle right now has the BLT ointments, which are great, since those are supposed to be compounded, patient specific. There's also consistent quality and pricing, which is really useful. As I said, if you're maybe talking to a rep from one of these places, it can be difficult to get what's the real price, what am I paying, just making sure that everything is set up correctly for you. And that's where we come in. And then this landscape, although it was never disallowed, really has taken off in the last couple of years. So this is not going to stop. All of the 503Bs, even if, let's say, they started out with GLPs selling to pharmacies, they are all expanding their catalogs. So you're going to be seeing new products coming constantly, and we are going to keep you updated as they do. The other component, or the next component to our GPO, is central fill. So central fill is a similar way to get your patients compounded prescriptions. You can get those combination GLP formulations. You can get custom compounds. Right now, we work with a couple of central fills, and they have over 50,000 SKUs in their system. They have both human and veterinary. And what's great is if you have something very specific, you can always reach out and say, hey, I have this product. Can you make it? How much would it be? So central fill, I'll just do a quick overview for you guys. You would receive the prescription in your pharmacy, then you would send it out to the central fill pharmacy, who would fill the product for you, send it back, and you would be responsible for the to dispensing to the actual patient. And the next component that we have in our GPO right now is telemedicine. So I am always telling people, you can see the growth that's happening with these companies. So I always say, if you want to know what's selling or where you can focus your efforts, look at what the big telemeds are doing. So the weight loss, the sexual health, things like that, you can look to that and say, okay, well, these are all things I can implement in my pharmacy. And what's nice about the telemedicine is that you can white label it for your pharmacy, so you can have a link on your website or however you want to provide it to your patients. And then they're going to be able to access a doctor who, if appropriate, will write the prescription for them, as they would with the big telehealth, but the prescription is going to come to you. Again, we like to keep our patients in our own pharmacies. And there are a lot of places out there where you can't really trust where these products are coming from. So if your patients are going to have a choice of where they want to get it, they're going to want to get it from you, as long as they know that you have it. Another great thing about the telemedicine is that you may want to start a new type of therapy in your pharmacy, but maybe the prescribers in your area are not really familiar with them. So they might just refer them out. This gives you the opportunity to say, like, hey, if these prescribers aren't comfortable with prescribing these newer medications, or medications that have been around for a while but aren't your typical ones, you have something to offer them. And then you're able to watch that fulfillment from end to end, make sure your patients are getting the prescriptions that they need. And the last component that we have right now within our GPO is going to be some law partners. So, of course, as you're navigating all of the nuances of central fill, of dispensing GLPs, of 503B products, we always recommend checking with your board to see if they have any specific stance. And then there's always going to be state-specific regulations. So it is nice having these options as well in case you want to check in. Specifically, my state is doing it. This is the way the payment is moving in my pharmacy with this clinic. So it is really useful to make you feel more comfortable with your business. And then we'll dive a little bit into Atrium and your Dotti membership as well. To be part of the GPO, you do need to be a member. Um, but Dotti is a full sales system. So when you're implementing these products, sure, maybe you know what they are now, maybe you can buy them, but how do I market them? How do I track my sales? It's all included in your membership. So Dottie provides that data to drive growth. So you can look and see, what are my top prescriptions? Who are my top prescribers? Maybe who was prescribing GLPs that are really into the wellness space that now I can move in with Sermorelin or NAD. And then also it includes the CRM at all membership levels to support your sales and marketing initiatives. So you can really keep track of the prescribers you've reached out for, who's interested in what, all of the marketing efforts that you have had. I always like to say too, as a pharmacist, it's really great because then you can see what have your sales representatives been doing. Obviously, you can even enter notes as well. You spoke to the doctor and maybe they had this concern or you offer this specific pricing, but it's great to let everybody in on what's going on. And then we also have clinical and marketing resources. We have a learn menu, which has some webinars and also some members only training into some of those new wellness products. Sometimes it can be a little bit overwhelming to introduce these things in your pharmacies, especially for a rep or a tech, or even the pharmacists who aren't familiar with them. They give some really great overall points on what these medications are, how they're utilized, and really the most important marketing things you're going to need to know as you go out into the field. And then the marketing resources are really great because, you may have great ideas about implementing it, but it's hard to find the time to create the materials that really go along with these pieces. So we do have things like prescriber sell sheets, patient information sheets, order forms, which you can utilize for actual prescriptions or just to help the doctors realize how things are written and things like that. And for GLPs, that'll be included the full programs for everybody. And then some of the programs, as they get a little bit deeper, are offered for our Plus and Pro memberships. But we are there to help guide you on how to expand these services into these new profitable areas into your pharmacy. So it really does help with your growth. And right here, we have an example of one of our pharmacies. As you can see, their script count went from 765 a week to 1425. And their margin from 38,000 to 80,000 per week. So the script count doubled, margin grew 132%, sales rose 177%, and then the gross profit increase of 168,800, which is a great representative of what Dotti can help you with. So this particular pharmacy was utilizing all of the marketing materials and then also utilizing the GPO. So this specific pharmacy, I want to say they sell about 50 503B products. So it's a huge area that they have taken off with. And they are doing really great, amazing work with it. But it is possible. So we like to show this to show you that that there really is so much room for growth for these types of wellness medications and how the marketing efforts can really help you grow. And then as an ROI, just the savings on one 503B order could pay for your Dotti membership or the profit on one script. If you're selling an NAD script, you're probably marking it up over $100. There's the cost of your membership if you're doing a basic membership, per month. And then you get all of the other things as well. So that's just the savings that really could pay for the membership. But you're also going to see all of the things like the CRM that's going to allow you to track those efforts and help you with some of those marketing resources as well. So this is a little snapshot here. On the left-hand side, it's going to show you if you were already inside Dotti, if you were a member, where you would access our GPO page. And we do make it very easy. So we have everything streamlined and set up for you on that GPO page. You'll see a registration. and then next steps, and sometimes where to order, depending on if the facility has their own portal or not. But it is all in one spot, and it's pretty easy there for you. Of course, if you have any questions, reach out to us anytime. And the QR code on the right does show you how you can just get started with Atrium24. If you want to know more about the memberships, I just briefly touched on Atrium24 and Dotti today, but there is a lot more to it as well. So definitely reach out to us there. You can screenshot it here, or else there's going to be an email at the end that I will review with you guys as well. And then the last thing we always like to mention is our conference. So coming up in March is going to be the second Atrium X conference. And honestly, I was so impressed last year. It's not a typical conference setup where you just hear about, what the people presenting there want you to know. You're not just being talked to, you're really developing the conference as you're there. So you'll vote on the topics that you want to hear about, and it's really collaborative. So you get to speak with other pharmacy owners. We have a lot of experts in the fields that we know are really interesting to people, 503Bs, telemedicine. We had some lawyers there last year as well. So it is really cool. It's a completely different setup. And, you know, with this new setup, I was even a little hesitant last year. How's this going to turn out? But it was truly amazing. I sat through all of the presentations and the breakout sessions where pharmacies were really able to collaborate. So we'd love to see you guys there. It's March 5th through 7th, and it's in Orlando. So come enjoy the nice, beautiful weather with us. And then if you do have any questions and you didn't get that contact form, you can always email in at any time at hello@atrium24.io, or you can call us. The number's listed there, but you can see all that on our website as well. If you're interested in how you can get started and how you can start taking advantage of these cost savings with these new innovative medications, let us know. Have a good day. Bye.